Alright, so before we start the head to toe assessment, we have to confirm the order and gather our materials, which I already have. Alright, so we're going to get started. Mr. Teddy Bear, my name is Billy and I'll be your nurse today. I'm going to go ahead and close the door and wash my hands. Alright, so we're going to first start off with getting your vitals, and I'm going to make sure it's okay for me to do a head to toe assessment now because that's very important. You don't want to disturb their time. So is it okay if I do a head to toe assessment now? Okay, good. So we're just going to do your vitals first and then we'll go to your head, and I'll explain it to you as we go on. So I'm going to get your temperature. If you can go ahead and put this under your tongue for me. Beep, 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 98.6. Then I'm going to get your pulse. Alright, your pulse is 86 and your respirations are 16. So that is good. I'm going to get your blood pressure. Have you had any surgeries or prefer any arms? Which arm do you use in getting your blood pressure done? No? Okay. We're gonna slip on the cuff. You want it to here, and you want to make sure that on the blood pressure cuff it says left and right artery on the cuff, so you know, like if you're using this arm, where to exactly put it over the artery. So we're gonna use your brachial. So we're just gonna start here. Alright, 120 over 86, which is in the normal range. You want it around 120 over 80, so that is good. Next, I'm going to get your pulse ox. I'm going to go ahead and put this on your finger, and it'll read the level of your oxygen. Alright, it says 98, which is good. You definitely want it in the 90s. You would really want it in the high 90s. You don't want it too low. And we'll have to do some interventions if it's too low. Alright, so next I am going to check your head for any lesions, cuts, abrasions, anything like that, bruises, bumps. Alright, so I'm not finding any abnormalities, so everything looks good. Next, I'm going to check your eyes, your face's symmetry. Can you smile for me first before we move on to your eyes? Okay, good. Alright, I'm going to have you follow my pin light. Just don't move your head, please. Alright, good job. So your eyes are about a 6, and I'm just going to test them with the light. Alright, so now they're about a 4, which is good. That means your eyes reacted to light normally. They're in. Your eyes are intact, there's no lesions. Your eyelids are freely moving. Your sclera are smooth, white, and glistering. Alright. So now we're going to go to your nose. I'm just going to check it in there. Alright. So your nose is symmetry is good. Your nasal mucosa is pink and moist. Your septum is intact. And there's symmetry in your septum, so that's good, and you have no lesions. Next, we're going to go to your lips. They aren't dry, so that is good. They're not cracked. They're intact, and they're symmetrical in midline. I could tell when you smiled. I'm just going to have you open up your mouth for me and go, ah. Okay, good. So your mouth your mucosa is pink, moist, and intact. with no lesions. Your teeth are white, as I can tell. If you can go ahead and open up for me again. There's no decay. You're a good repair. We're going to check your tongue again. Alright, your tongue is pink, moist, there's no lesions, your papillae are intact, you have no nodules on your tongue, no cuts. You're able to move it fully. Is there any tenderness or anything? No? Okay, good. Next we're going to go to your ears. And two of the tests you can do for ears are the Weber and the Rhine ear testing. Alright. So you're able to hear pretty good. There's no wax buildup. You don't have any drainage. Are they tender? No? Okay, good. And you have no breakdown. So that's even better. You're doing pretty good. Next, we're going to check your neck. So if you can go ahead and roll your neck around for range of motion. If not, if you need my assistance, we'll do passive range of motion. So we'll go counterclockwise, and then clockwise. Next, I'm going to check to see if your trach is midline. Alright, so that's intact. You don't have any JVD. I'm going to check your carotid artery. Alright, that's good. Now we're just going to check your lymph nodes. Alright, they're not swollen. So that is good. Next, we're going to check your skin to make sure you're not dehydrated or if you have any scars. So I'm just going to do a skin turgor test where I just pull up your skin, and if it goes down, that means you're hydrated. Alright, so you're hydrated, so that is good. Do you have any scars or anything that you'd like to inform me of? No? Okay, good. Your skin seems to be in good condition. There's no redness or breakdown that I can see of so far. Alright, so next we're going to go to your chest. Your chest looks pretty symmetrical. I'm going to listen to your lungs. I'm going to have you take a breath in through your mouth, out through your nose. Go ahead. And again. And again. And again. Okay, good. So your lungs sound pretty clear on your front side. We're going to try it on your back side now. So if you can go ahead and lean up for me. And again. And again. And again. And again. And again. Alright, so those were all good. Now we're going to just check your arms. Your breathing was real clear. Your lungs were clear. You didn't have any crackles or wheezing anything. So no abnormalities there. So you're breathing regular. Normal as always. We're going to check your upper extremities. We're going to do some range of motions. If you could do your arms like in a circle, the other way, in front of you, above your head. Alright, good. So I'm going to check your capillary refill. I'm just going to press down on the tip of your finger like this to see if you have capillary refill, and it shouldn't take longer than 3 seconds to come back. I'm going to have you squeeze my fingers to check your strength. Okay, good job. Alright, now we're going to check your abdomen, so I'm just going to pull the blanket down a little bit on you here. Alright, so your belly is round, it looks pretty good, no scars or anything. So I'm just going to listen to your bowel movement, so I'm going to listen to your intestines. And if you don't hear bowel movements, you want to make sure that you listen for 5 minutes before you just say, oh, they don't have any. because that's what protocol is, and you definitely want to make sure that nothing's going on, there's no obstructions, anything like that. Alright, so next I'm gonna percuss your belly. So I'm just gonna. Alright, did that hurt at all? Was there any tenderness when I did that? If so, could you tell me where? No? Okay, good. Just gonna palpate your stomach. Alright, good. That was really good. So your bowels are all good. They're all normal. Could you tell me when your last bowel movement was? Just today? Oh, okay. Good. Is it normal? Do you do any straining? Use laxatives? Feel constipated? No? Okay. So you don't want to rely on laxatives, and you don't want to strain yourself because that's not normal. You can actually get a hemorrhoid from it, which is not good nor comfortable. The perineum, I won't use the bear simply because the bear doesn't have any parts. So if you're going to check the perineum, you're going to check the hair distribution, you're going to check for the clitoris, make sure there's no redness, you're going to check the meatus for discharge. Lesions are swelling, the mucosa is pink, should be pink and moist, some clear discharge and odor-free. If it's not odor-free, that could mean that they could have a UTI, which isn't good. So that you would definitely want to make sure they don't have one of those. Any symptoms of it, if they do, then you want to get a urine test and culture. You want to get it analyzed and cultured to find out if they for sure have a UTI. You want to check for any masses, and you want to make sure the muscle tone is good, and you want to palpate the lymph nodes. Alright, next we're going to go to the back and coccyx. So first we're going to assess first we're going to assess for redness or any open areas like pressure ulcers or shearing or anything like that. So I'm just going to have you roll over for me on your side. I'm just going to kind of move it closer so you can see. So I'm just going to hold him up here. Alright, so I don't see any redness on your coccyx area. And if there was, you're going to measure it length by width. And if there's any tunneling or anything like that, you would do length times width times height, or depth. Excuse me, not height, depth. You're going to check the spinal alignment, so I'm going to have him stand up here, and I'm going to have him bend forward. I'm going to check his spine alignment, and it's all intact and good. No curving, no signs of scoliosis. So far, after checking the skin alignment, also while you have him standing, you're able to check if he is full weight bearing, partial weight bearing, or he can't hold himself up at all. So right now I can tell that he is able to fully bear his weight, so he's able to stand himself up, hold all of his weight without any issues. Are you able to stand up? Does this hurt at all? Do you have any pain? No? Okay, good. Lay back down here. I'm going to check his lower extremities. So I'm just going to hold him up again because you can't see his legs in the video. Alright, I'm going to have him do a range of motion. If they can't do it on their own, then you can do passive range of motion and help them. So I'm just going to move him for him. Alright, and I'm going to check capillary refill. I'm going to do the same thing I did for the nails. So you just pinch the tip of his nail and let go of it. And if it refills in 3 seconds, that's good. That's a good sign. Alright, I'm going to check the strength of his post-tibial pulse. And I normally check it at the same time. It's a little hard since I'm holding him up, so I'm just going to do my best. Alright, so I'm going to check it right in here. Alright. So you can determine if the strength of the pedal pulse and the post-tibial pulse by 1 through 4, 1 being the weakest and 1 being the most rapid. 2 is dimmest and 3 is normal. So I would say his post-tibial pulse is a 3 since it's normal. Next you'll check the pedal pulse, which is on the top of the foot here. Alright, we're going to check it. Alright, good. It's also a normal. If it was weak, normally that means that the circulation is being cut off, but if you can feel it in the pedal pulse, then you can definitely feel it in the post-tibial pulse. Alright, and you won't have to check the femoral or any other ones on his legs. Alright, so next we're going to assess for edema. That's any swelling, and I don't see any swelling on his feet, so his feet are all good. I'm just going to have you push and pull on my hands here. Alright, good. Alright, so now we're going to do some safety and comfort. So I'm just going to cover him back up, make sure he's comfortable, not in pain. I'm going to give him his call light, his remote to his TV. Make sure he has all of his personal items in reach, so his water, his cell phone, anything that he may want on his tray. After that, I will perform hand hygiene and document my assessment. Thank you.